In the part 1 video on anesthesia without opioids, the pioneer of opioid-free anesthesia, Jean-Paul Mulier, told a fascinating story about how opioids became overused in the practice of anesthesia and how bad opioids are and how opioid-free anesthesia was born. But in this part 2 video, we will discuss how nerve-wracking can be practicing anesthesia without opioids. When you just start doing opioid-free anesthesia, isn't this like a stressful because you used to give him
terrible stressful
opioids all the time?
You have to be crazy to start doing that. Absolutely. So if you are trainee or you start, that is impossible. Happily, I had good surgeons supporting me. Happily, I had already the case with the hypnosis. They said, if Jan is doing something crazy, that doesn't mean it is wrong.
And indeed, here's what I always say to my surgeons. A good surgeon deserves a good anesthesiologist, but a bad surgeon needs one. Fortunately, Jean-Paul had some great supportive surgical colleagues which helped him craft the opioid-free technique as a team with his surgeons.
That's very, very important. And most of all, you have to say, look, we look for the patient, we will measure everything, and that's why we start measuring other methods of stress, so to guarantee there was no stress. But I must say, I felt like a first-year resident again in the first cases of doing, because as a first-year resident, you say, how much opioid, how much fentanyl am I going to give? 1 cc, 2 cc's? You look to your, I say, how did you give? It's a knee, or 2 cc is sufficient. It's a fast surgeon. But if you react, maybe give 4 and you're sure. It's no problem. You can give, you are ventilating the patient anyway. And if he's not breathing very well, we have an antidote also.
Reverse.
And breathing a little bit, we give oxygen. Everyone gets oxygen. And so realizing everyone is in some depression, respiratory depression. So I felt like a first-year resident starting again, because now how much should I give of lidocaine? How much should I give of dexmedetomidine? You can give very high doses, but what I was sure, I'm not going to do veterinary medicine, and I want my patients waking up fast. That's important, because everyone will kill me if waking up and extubation is long, if the patient has staying very long in the recovery room.
And that was a part 2 of this fascinating story of the birth of opioid-free anesthesia and the skill that is required to practice it. Be sure to subscribe to the channel to be notified when part 3 interview with Dr. Mulier is released on practical management of an opioid-free anesthetic. Until next time.